Good morning and welcome to NAMI New Jersey's webinar series. My name is Jennifer Hughes and I'm the Chief of Staff at NAMI New Jersey. Today's topic is SAMHSA 101. It's not just about the grant money. SAMHSA is the Substance Abuse and Mental Health Service Administration. We are honored to have our distinguished speaker, Carl Shallowhorn, joining us today. Carl Shallowhorn is a special expert for SAMHSA Region 2. Carl has worked in the field of behavioral health for over 21 years. He has his MS in Student Personnel Administration from SUNY Buffalo State and is a New York State credentialed alcoholism and substance abuse counselor. Carl is the author of Working on Wellness, a practical guide to mental health and leadership through the lens of the 12 steps. He is the host of Mindful Music, which is heard on 88.7 in Buffalo, New York, NPR station. He has received numerous awards, including from the Buffalo chapter of the National Federation for Just Communities and Buffalo Association of Black Social Workers. Carl has delivered several hundred workshops and trainings focusing on behavioral health and was a featured speaker for TEDx Buffalo 2021, with this topic being centered on African American men and mental health. Carl is a person in long-term recovery from co-occurring bipolar disorder and addiction and lives in Buffalo with his wife, Susie. Carl, we are grateful to have you here and we look forward to your presentation. So I'm going to pass it on to you.
Thank you, Jennifer. It's a pleasure to be here, and I want to welcome everyone today to this webinar. Hopefully, you're able to take away a few nuggets of information. And so I just want to add another personal note. My connection with NAMI goes back to around 2008 here in Buffalo, when I just wanted to tell my own personal story. So I reached out to the folks here at the NAMI Buffalo Erie County organization. And I went to a family education group and I shared my story. And that was the first time I spoke publicly about my own lived experience with bipolar disorder and co-occurring addiction. And it's been a real ride ever since. It's been over 15, 16 years. And my experience has really been able to kind of guide me in my career since that time. So just wanted to share that little bit of information. So let's just jump right into things and talk about our topic today. So basically, as you see here, we're going to talk about SAMHSA. And there are a lot of misconceptions about SAMHSA that you may or may not even know about. But sometimes people think that SAMHSA, oh, it's just about grants. You're the ones with the money. And there's so much more to SAMHSA than what people oftentimes think about. So we're going to cover a lot of that today. And it's a really more of a comprehensive overview to the topic of what we're going to go into today. So really, our objectives today are to learn more about SAMHSA, our mission. We're going to look at the behavioral health landscape. We're going to talk about grants, resources, and training, and then we're going to wrap things up with the regional offices and as well as some information on some resources. So let's just go right in and talk about SAMHSA, who we are, and our mission. First of all, SAMHSA falls under the umbrella of the Department of Health and Human Services, which you see here has 11 total operating divisions. Everything from the Health Resources and Service Administration to the Federal Drug Administration to the Centers for Disease and Control and the Institute of Mental Health and so forth. So there are 11 agencies under this department, and SAMHSA is one of them. And SAMHSA is the one, of course, that covers everything related to substance abuse and mental health and everything in between. So let's just go more into what SAMHSA is. First of all, I want to introduce you to Dr. Miriam Delphin-Rittman. She's Assistant Secretary for Mental Health and Substance Use. She is the head of SAMHSA and has had a wonderful 5-year career with SAMHSA and has been the one who has kind of led the charge for what we're doing. And in 2003, we developed a strategic plan that covers basically the 4 pillars of equity, trauma-informed approaches, commitment to data and evidence, and recovery. And in this area, as you can imagine, equity is so important these days because we want to understand mental health and substance abuse from the idea of treating people equally and understanding that there's so many common threads that run between these for everyone. Trauma-informed approaches, of course, are something that are very big in the behavioral health world right now. Understanding that trauma is something that is a major risk factor for mental health and substance use behavior disorders. So we know that many people who are dealing with these conditions have come from a trauma background. So when many behavioral health providers are working with individuals, they do take a trauma-informed approach. SAMHSA is certainly committed to data and evidence. As you're going to hear me talk about later, we have a division that's devoted specifically to just data gathering and research. And we use that for a big part of our dissemination of information for providers and for individuals that are looking for information when it comes to, say, seeking out grants and so forth. So that all kind of ties together. And lastly, recovery. I mean, when you think about it, it's all about recovery, and it's all about understanding that people do recover. And I know in my career, I've encountered so many people over the years who have been able to find a new way to live and be healthy in their own communities. So our priorities, as you see here, are about enhancing access to suicide prevention and mental health services, promoting resilience, integrating behavioral health and physical health care, strengthening the behavioral health workforce, and preventing substance use and overdose. So when you talk about strengthening the behavioral health workforce, this is a big one right now that I know we're focusing here in New York State. I'm based out of Buffalo, like you heard in my bio. And here in New York, we're talking about the workforce development issue. And there's so many people that we recognize are in need of help that we need to strengthen our workforce. So this is something that SAMHSA is strongly behind and strongly advocates for when it comes to getting people into the workforce. I'm going to talk later about our new behavioral health care workforce navigator, which is one of the things that we've designed to help people in that effort. Certainly looking at preventing substance use and overdose. This is something that's a big part of SAMHSA's work, whether it be through the work of harm reduction policies and things like that, or through understanding how naloxone is used, which is basically Narcan. And so we do a lot of training around that. We do a lot of gathering information and dissemination of information on these topics. So really, SAMHSA is just really looking into the future and is always thinking of these innovative ways to help people in our communities. So let's take a step back and talk about stigma, because it's more than just stigma. We're talking about cultural bias, prejudice, and discrimination. And so really, that's really a lot of times what you talk about stigma. It is discrimination. So as you see here, the definition is it occurs when an individual is treated less favorably than another person in a similar situation for a reason related to a prohibited ground. Now, we know that people with mental health substance disorders are oftentimes mistreated or misunderstood. There's higher rates of homelessness and unemployment. And we know that individuals living with mental illnesses often are seen as dangerous to society, even though that is a myth. We know that people with mental illness are oftentimes more likely to be the victims rather than the perpetrators of these types of crimes or violence, and are more likely to encounter law enforcement to get medical help. Of course, in our communities, there are many times when individuals who are having challenges, and there might be an instance where law enforcement is called and involved. Unfortunately, this is when things happen, and sometimes there might be a need for an intervention. However, it may not always turn out the way that we want. There are many law enforcement agencies across the country, though, now that are doing things like CIT, which is Crisis Intervention Team Training, that are be able to help their officers understand better how to respond rather to these instances. And many law enforcement agencies are bringing on behavioral health providers onto their teams to help. So that is actually a positive thing in our community. Language matters. And so we always use person-first language. And I'm going to talk about that in a second, but we want to reject labels that are stigmatizing, like addict, crazy, and so forth, and understand that when you use these labels, it basically helps a person to, diminish themselves in terms of how they see themselves. So what we understand is that language does matter. And you see here, there's preferred language versus stigmatizing language. So we would rather use the term substance use disorder versus substance abuse, or died by suicide versus committed suicide. When you hear the term committed suicide, oftentimes we think of committing something, which is like committing a crime or whatever. So committing usually has a negative connotation with it. And it also implies more of a moralistic, moral behavior, as opposed to something where there might be actually a mental health challenge underneath everything. Absence or substance free versus clean and sober. I know a lot of times in 12-step programs, they use the terms clean and sober. But often when you think about that, there may be ways that those are used that might be more stigmatizing for people. There's a recurrence of substance use disorder versus relapse, person with substance use disorder versus an addict, and person living with depression versus depressed person. So that idea of person living with depression or person with substance use disorder, that's person first language that we're talking about right there. And it really means a lot because you're putting the person first before the condition. And one thing we understand too is that if a person has, say, a mental health condition or a substance use disorder, that's just part of who they are. It's not all of who they are. As you heard, myself even, I have bipolar disorder. I live with bipolar disorder rather, and I also live with a co-occurring addiction disorder. That's just part of me. It's not all of who I am. So when I like to see myself that way, and that kind of gives me a feeling that there are many parts of me that are also assets, as opposed to things that might be looked at negatively. So now let's take a look at the behavioral health landscape and ecosystem within SAMHSA as regarding federal, state, and local infrastructure. First, we have the behavioral health ecosystem. In the center, we have the care continuum from early intervention prevention, which includes mental health promotion as well, through primary care, crisis care, specialty care outpatient, then inpatient, all the way through to recovery. So as you see here, that's the core of the behavioral health ecosystem. So when you look at it that way, this is where it all begins. This is where the first touch point is for people, where it really affects them directly in terms of how they get help. So we know that we want to make sure that these things are supported in every way that we can. Prevention and health promotion, early intervention is so key because we know that the earlier the person gets help, the better are they going to be to recover and be able to get to the life that they want. I think about myself. I entered the behavioral health system when I was about 18. And I was very fortunate in that I was able to get help immediately. It took a number of years for me to kind of grasp what it meant to stabilize my condition. However, I was very fortunate to be able to have access to good health care and good treatment and therapy to help me. Not everybody has that. And so that we talk about the idea of equity, going back to where I was in the beginning, we want to make sure that everyone has these opportunities. Some people get their help through a primary care clinician for the first time, or primary care physician for the first time. That might be the first touch point. Crisis care, some people might get it through calling 988. I'm going to talk about 988 later, and so forth. So there are other ways that people can get help with their mental health as well, and their behavioral health. The next ring are the 8 dimensions of well-being, and the idea that these impact a person no matter where they are on the care continuum. So as you see here, we have the environmental, social, spiritual, financial, occupational, intellectual, emotional, physical challenges, dimensions of the well-being continuum. And all of these factors play off each other. And we want to make sure that these are well-rounded and that these are all looked at, and persons are be able to give the opportunity to develop in all these areas because they all are connected. When a person's not doing well in one area, it may affect the other area. For instance, if a person isn't doing well physically, it might affect them spiritually, or it might affect them emotionally. If a person isn't doing well, in terms of occupation or financially, it might affect them in other areas. So we know that we want to do our best to encourage people to seek their help to get what they need and make sure that they are able to access the care and make those changes and challenges. Finally, we have the outer ring, which is the social determinants of health, or the systemic circumstances a person's in. Many times, individuals' locus of control may be less in this ring, and it's important when we talk about equity. And we talk about locus of control, which is what a person has control over in their lives. So, for instance, if you look at economic stability or educational access and quality, they may not have as much control over these things. However, we need to make sure there is access to good healthcare and quality, and also to proper social and community context. If a person is doing well in this area, they're less likely to have mental health challenges or even physical health conditions that affect them. So social determinants of health have become a really big thing in recent years. And we know that there are many people who are dealing with these things in their daily lives that affect them in every way they can imagine, especially around their behavioral health. I'm going to pause here for a second before we go on and ask if there's any questions. If there's anything that's come up, I'm going to stop for a second and ask.
Thanks,
Jennifer?
Carl. I don't see anything in the Q&A box right now, so you can move forward.
Okay, thank you. All right, now let's just take a look at the behavioral health landscape. So now that we have a sense of the ecosystem, we're going to look at the three levels represented here in the triangle. At the top, there's relatively little control compared to the other layers. We have the federal level. Next, we have the state level systems, and finally, the local level. All these impact the way mental health and substance use, or behavioral health for short, works in your community. So at the federal level, we have lawmaking, regulatory action, guidance published by federal agencies like SAMHSA. We grant funds to state and local partners and try to build public-facing supports available to the American public like resources. So the federal level here is really where a lot of things take place that affect us. And I'll get more into the nitty-gritty a little bit later, but this is really where our policies are brought into place. There might be funding, as you see here. We talked about funding through SAMHSA, through grants. I'm going to talk about grants more later, and other supports. So as far as the state and tribal area is concerned, we have the lawmaking, regulatory licensing, departmental guidance. And in this area, we're focusing on things like, for instance, in New Jersey, you might have, in JAMA, which is a behavioral health provider, or agency rather, that works with all these different providers across the state. They're affected by laws that are in New Jersey to ensure that people are given the help that they need, and they are able to ensure that there's policies and there's supports available for them. There's also funding, also in terms of state funding, and that happens through the appropriation system and through the state budgets. And locally, there is direct service. So this is really where people are directly affected. So you might have, say, direct service in terms of people going to get help from agencies. There's city, county, school districts. So really, this is where you might have folks that are getting help through behavioral health providers and other systems. And this is also really important too to consider, because when people need help, that's where they go, right? They're not going to go to the state level or the federal level, obviously. They want help on the ground level. And this is really where it's so important. NAMI is a key player in terms of providing support for families. And so we know that agencies and organizations like NAMI and JAMA are doing their work to kind of connect all the dots for all the people in the local areas.
Carl, I'm going to stop you for 1 second because we did
Sure,
get a couple questions that came in.
sure.
So one question is, how do you see this being established in the advocacy of justice-involved individuals?
So when people are involved in the criminal justice system, we know that there, for instance, SAMHSA has a lot of initiatives involving people who are involved in the criminal justice system. There's TA centers and there's supports that are provided to support individuals and provide assistance. And so the federal government does a lot when it comes to the involvement of individuals in the criminal justice system. There's a lot of different initiatives that are taking place that trickle down, I guess you could say, to local agencies. So there's a lot of work that's being done that's behind the scenes. And then the federal usually goes to the state and the state to the local. So it's usually that way that the funding kind of follows. There's block grants, there's other types of grants to assist individuals. There's work being done in terms of even prevention work that's being done. So there's a lot of things that help people in terms of, their involvement with the criminal justice system that may be involved as it ties and relates to behavioral health. We know, of course, that there are a lot of individuals that are in our prisons and jails that are affected by mental health and substance use challenges. And so we know that we want to make sure we address these things so that they're able to be taken care of and aren't able to, or rather, they don't keep through that revolving door of the criminal justice system that is so often there for many people.
Thank you. And another question was, when you were talking about New Jersey services, what was the group you said that was in New Jersey?
Oh, Ninjama?
Najama. Thank you.
Yes. And Ninjama is the New Jersey Association of Mental Health and Addiction. I believe it's advocates or no, agencies. I'm sorry, agencies.
Agencies, yes.
Yes, agencies. Yes, thank you. New Jersey Association of Mental Health and Addiction Agencies. Yes. And so basically, Njama is kind of coordinates and does a lot of work with behavioral health providers and other organizations across the state. Deborah Wentz is the CEO of the organization. And in fact, we're going to be doing some things with them also, in the springtime, probably around funding and helping New Jersey, get better access to grant funding. I know that's one thing that we're working on right now. I was going to mention that later, but I'll mention it now. So, but Ninjama does great work. So that's the agency that they are.
Thank you.
Sure.
So there's one more question and then we can move on. So don't counties on the local level offer grant funding too? I've seen funding opportunities at at that level for mental health.
Absolutely, they do. So of course I live here in Buffalo, which is part of Erie County, and Erie County does offer grants. Certainly not at the level, financially as perhaps a state and federal, but yes, counties do offer grants in terms of helping through behavioral health services.
Great, thank you. And one more just came in. How can we as family members or faith-based organizations help an individual who needs the help but pushes back in receiving it? I think this person is asking for some lived experience.
Yeah, and I'll have to say, Jennifer, and to the person who asked that question, that is probably the question I've gotten more than any in my career. How do you help someone who's resistant? And I think it goes back to really listening to the individual and asking them, how can I help? And, I want to be there for you. This is really where you get down to a personal level with individual. Oftentimes it is a loved one and it is someone that you care about and you see there might be some suffering. And so really we want to be supportive and we want to try to let them know that we are able to help them or that I am able to help them in whatever way I can. It's a struggle though, I will admit, because sometimes people do refuse help. And that's hard to deal with if you really care about the person. I know if there's the mental health first aid program, which is really good. If you've heard of that program, mental health first aid is one that helps individuals how to respond to people who are dealing with mental health crises and so forth. And there's exercises in that program to understand how to best approach someone who's living with a mental health and behavioral health condition. But oftentimes it's how we listen, right? And so we want to make sure we're there for the person and that we say, like I said, I'm here for you. What can I do for you? And also, how's it working for you? I mean, to be honest, if that person isn't doing well, you might want to be a little bit more firm and say, well, listen, I know you're not doing well. And so if it hasn't worked, let's try something a little bit different. Let's try a different approach.
Thank you, Carl.
Sure. So let's move forward a little bit and talk about the core features of a behavioral healthcare system. So as you see here, there's a number of items, including emotional health and well-being, are vital to our overall mental health, overall health. So we know that our physical health and our emotional health is as important as our physical health. So they do go together. I know there's this idea of getting the checkup from the neck up, right? You might have heard that saying. So we know that individuals have to take the time rather to take care of their mental health to make sure that their physical health is okay. Um, Also, the idea that we're talking about chronic illnesses here. These are things that don't go away. I mean, myself, I've lived with these conditions for most of my life. They're present. I can recover, but it's more like they're in remission. So that's how at least I choose to look at it. We also want to make sure that there's equitable treatment and access, which is crucial. Also, science is important to consider. You look at data. We have to consider science in all of this. There's a lot of myths surrounding mental health, a lot of myths around behavioral health that are out there, a lot of things that are floating around that just aren't based in facts. And so we have to look at the science and understand the research. Also, in terms of behavioral health, it should be integrated and coordinated across all these systems and services. So we want to integrate behavioral health into these things to make sure that it's understood that it's as important as anything, as we said before. Also, it has to be tailored to the individual. If you look at a person who's living with a behavioral health condition, we need to understand that it's them. You can't just pigeonhole people or put people all in the same category. Yes, we have diagnoses. We have the DSM, which is the Diagnostic Statistical Manual, which has every behavioral health condition and every behavioral health disorder in it with all the criteria and so forth. But we have to understand too that people are individuals and they have individual circumstances. That's important to consider. And finally, a well-trained, competent, and current behavioral health workforce is essential. And as I mentioned earlier, we talk about workforce development. We need to make sure that people are trained properly so they can respond to the people's needs that are out there. And it's crucial because when you think about it, if our workforce isn't trained, then how will they be able to help our loved ones? So we have policy here, as you can see, and these are really a lot of the policies that have come through over the last, say, 20 years or so. And a lot of them have been over the last 10 years. So, but basically, HIPAA has been around for quite a while. HIPAA is one that oftentimes I know families aren't very fond of because it involves privacy laws. And so if you have someone in your family who's over the age of 18 and you've had this experience, which many people have, you can't always get information on them unless that person signs a release for you to do that. That can get in the way. There's been some discussion of amending this law. And I'm not sure exactly where it's at right now, but I know there is some discussion of this in terms of the regulations. Who knows where it'll go though? Should it be loosened? I can't comment on that, but I think there is it's something that definitely affects people. Another one to look at really importantly here is the Mental Parity and Addiction Equity Act, where we look at mental health and addiction on par with physical health conditions so that they're treated equally by insurance providers. That's really important too. And then the Bipartisan Safer Community Act, which is the most recent, that's all part of too in terms of looking at policies that affect our local communities in terms of how behavioral health plays a part. Was there another question, Jennifer?
There was one that just came in. Our loved one is in recovery. He applies for hundreds of jobs. The rejection is really discouraging. More of a comment than a question.
Yeah, let me just comment on that real quickly.
Mhm.
And I've been in that situation myself. Years ago when I was in the middle, and I went through my really significant struggles between the ages of 18 and say 25 or 26. And it was hard to gain employment and hard to remain on a job. Sometimes, they want to know about your work history and so forth. Um, One thing I would say is that to encourage that person not to give up, and there's always a way to make a way. Um, I think one of the things we have to look at here is finding something that is a good fit. And what I mean by that is that, finding say a track or a employment track that is a good fit for the person. I know that many people who live with behavioral health conditions may struggle in the workplace for one reason or another, but finding something that works for the person and it's going to enable them to be successful. And it's better to start off small. Like when I started off in my journey, in my career, I was working for a temporary employment service. I did that, if anything, just to establish routine with work. And that helped me a lot in the beginning. So I know for a lot of folks, starting small and then work your way up can be a good way to do it too. So never be discouraged. And I always want to try to let them know that there's always hope. And that's the thing about recovery. There's always hope. You have to hold on to that. That's the key thing. So now let's look at how SAMHSA supports your communities in terms of grants, training, and resources. And they all kind of, as you see here, are interconnected. So first of all, we can connect you with your state and local people doing behavioral health focused work. We can make national resources, and of course, we could fund grant programs, special projects, and meetings. So as you see here, we can't lobby for law changes, SAMHSA. We can't mandate a school or community-based organization does something, and we can't provide direct service care. So that's the key. So, SAMHSA can do certain things, a lot of things, but certain things that we can't do. Did more questions come through, Jennifer? It looks like they might have.
Yes, there was one about parity law. Parity law was an improvement, but has never truly provided parity of mental health care and providers with physical health care and providers. What's being done to address this?
Yeah, and I'm glad that's a good comment because, in theory, you're right. That's a good point, and I'm glad that person brought this up. In theory, it's supposed to be, the law, but many insurance providers do not do that. Um, we do have policies we're looking at. We do have ways to try to get insurance companies to take pressure. But really what it comes down to is at the local level, speaking to your legislators, getting in touch with your policymakers that are in your communities. Certainly voting is one thing. But then again, when we reach out to our legislators, our Congress people, our congressmen and congresswomen, let them know what we want. That's how we affect change. And if enough people make noise, then things will change. But and that's the problem with I think we are talking about here with parity. Unfortunately, a lot of the insurance companies haven't had enough heat placed on them to fully affect these laws. So we need to speak up. We need to let our voices heard, and organizations like NAMI can do that. So certainly, NAMI has been a big part of making change, and so a collective voice can make a big difference because that's what it comes down to. When they realize there's votes involved, that's when in staying in office, that's when they will listen.
Thank you so much, Carl. There's two more questions. One regarding the continuity of care. So when someone's in a mental health crisis during a psychotic episode, having access to inpatient treatment only, if a threat to themselves or others, and as soon as medical staff judge that the threat has subsided, they're out typically in the max of 2 weeks. Um, but the patient is still lacking insight, having paranoid delusions, cognitive impairment, um, the standard practice to offer further to continue services. How can we, I think they're asking, how can we encourage and advocate for continuity of care?
Yeah, so that's really important too. When you talk about, and I mean, I think part of the reason is that when people are in an inpatient setting, like any other type of hospital setting, they're looking to move people through, and certainly, that's not always the best way of taking care of people, but that's just the reality that I think, unfortunately, we face. So, but we want to make sure of though is that when there is a discharge there's a handoff to a local behavioral health provider, like an agency, for instance, or and usually an agency because there's more than say like an intensive outpatient program might be needed, or more intensive program that will allow that person to be, say, monitored and able to receive good care in terms of psychiatric care and other therapies to help with that transition. It's really crucial. So really discharge planning is a lot working with the social worker on staff and ensuring there's a good handoff. That's one of the best things I can say about that.
Thank you. And does SAMHSA understand this state of affairs and have any ideas, plans to improve care outcomes for the severely mentally ill population?
Oh yeah, we're always working on that, and that's the thing. I mean, we're always trying to find ways to be innovative and look at most current interventions and treatments. And I'm going to talk more about that later in terms of what we do. But absolutely, we look at science and we look at things that are able to help people more than just the status quo, right? And certainly we have really bright minds, work with SAMHSA that are doing these things. So give me a second, and I'm going to get more into what some of our providers do, or not our providers, but our agencies do within SAMHSA to describe a little bit more about that. So just give me a second, and I'm going to get more into that.
Great. And one more question regarding advocacy priorities for SAMHSA. This person was under the impression that SAMHSA was a driving force and player behind establishing the 988 system. Is that correct?
Yeah, I'm going to talk about that too.
Great. Thank you.
Yep.
Okay. That's all I
All
have
right.
right now.
Okay, so let's go into the grants, training, resources, which is exactly what I was just talking about. So first of all, we have different divisions. So the Center for Mental Health Services, we provide treatment, prevention and treatment of conditions. And so Congress created the CMHS to bring new hope to adults who have serious mental illness and children with serious emotional disturbances. So CMHS really provides a lot of grants. As you see here, there's many. So what we do is we take the funding that we get from the federal government, from Congress, I should say, and we put into these different programs that people can access to fund initiatives. So as you see here, there is the Mental Health Services Jail and Prisons Populations grants, the National Child Trauma Stress Network, assisted outpatient treatment, which is another thing that is one of the innovations. So there's a lot of things that we fund, that CMH has discretionary grants that fund projects on a local level and a state level. When it comes to substance use prevention, we have CSAP, which is the Center for Substance Use Prevention, that provides leadership and collaborates across sectors to advance prevention across the lifespan. And so we want to prevent inflation of substance use, prevention, progression of substance use, and prevents harm associated with substance use. So there's discretionary grants as far as, say, the Strategic Prevention Framework, Sober Truth on Preventing Underage Drinking, and Preventing Drug Overdose Health. All of these are in the area of substance use and are designed to trickle down, like I said, to local levels, and are basically done every year to ensure that there are things in place so that people can get the funding that they need to work in these areas for substance use prevention. And then CSAT, which is the Center for Substance Use Treatment, promotes community-based substance survives services, treatment as recovery support services for individuals and families in every community. So the grants that they have, for instance, are screening SBIRT, which is screening, brief intervention, referral to treatment, adolescent substance use disorder treatment, and so forth, medication assisted treatment, prescription drug overdose. So these are treatment programs that really are in local levels. I know here locally, there's an agency that just got an SBIRT grant for substance use. And so really, treatment drug courts is another big one. I know this is a huge part of helping people that are involved with the criminal justice system. That was actually referred to earlier in the discussion, in the presentation. Drug courts started in Buffalo in the late 80s. So it's been around for a while and it's all across the country. But there's a lot of providers that receive referrals from drug courts, and people's lives have been changed. Really, they've been made, a huge difference in people's lives when they're able to get into a system that is more humane. And instead of sending to prison, they're basically ways to divert people from the prison system. CBISC is about data. So Center for Behavioral Health Statistics and Quality is all about data collection. One of the big things that CBISC has done is the National Survey on Drug Use and Health. And that comes out every couple of years. And that has a ton of information, a ton of data that people use for grant writing and other research on mental health and substance use. So there's a lot of great data there. And then also the Drug Abuse Warning Network is a public health surveillance system that captures data on emergency department visits related to substance use and misuse directly from the electronic health records of participating hospitals. So, CBISC does a lot in this area. And really, I mean, talk about, the research is in the nitty gritty, but a lot of great information there through CBISC.
There is one question, Carl, about grants. Can
Okay.
individual practitioners apply for grants? If so, how?
No, typically, they have to be through, usually most grants have to be through a nonprofit or through a state system. So, at the very least, through a nonprofit. So a person, like an agency-based provider can provide, because usually those are nonprofit. They may or may not be, but they have to be a nonprofit provider. And then also, states can also apply for grants as well, and counties, but not not for individuals.
Great. And one question related to, I would say data a little bit. Does SAMHSA have informational science pertaining to AA and NA? Unfortunately, I do not believe that anonymous groups have been able to be successful and advocates for people who need support.
That's a good question. No, because the data on A and NA is really hard to capture. It's so fluid, and even A and NA has data on groups in the world, but not on individual number of individuals because it's such a fluid um, number, I guess I would say. And actually, even A and NA, doesn't track that information. I can speak from personal experience of being a member of a 12-step fellowship. So no, SAMHSA does not track that.
Thank you. And are the databases available to the public?
Yes. Yes. So as you actually see here on the screen, there's QR codes. But all you have to do is just Google NSDUH. And if you just Google NSDUH, SAMHSA, it'll take you to the page where you'll find the National Survey on Drug Use and Health. That's a big one right there that has a lot of data that people can use for whatever purpose they need it.
Great.
All right,
Thanks.
let's talk lastly about federal resources and support. So there's formulary grants, block grants, and other types of grants for people. And like I said, these are primarily for state organizations and agencies, as well as local behavioral providers and county providers. We have 988. So I talked about 988 before briefly. 988 is the National Suicide and Crisis Lifeline. Used to be a lot longer number, but in 2016 that number changed. Not 2000, I'm sorry, 2 years ago, 2022, that number changed. The reason I thought that is July 16th. That's my anniversary. That's why I remember the number, the date. And so it changed to 988. And this number is used because what it does is, and I'm sure many of you on the call understand, that it will patch you through to local crisis centers. In fact, there's been now an innovation where there's been geo-routing done, which has helped because if a person calls with a phone number and they're in a certain area, it won't go to the area code where the person's calling from. It'll go from where they're calling, if it makes sense. In other words, not the one that's in their phone, but where they're located. So that's a big advent right there. So, and 988 is crucial and it has counselors, but not just for suicide, but for people who are in emotional distress as well. So it isn't just a suicide thing regarding suicide. It's for those who might be in emotional distress. Another question?
Not regarding this, it's regarding the grants. So can peers in recovery apply for grants to offer telehealth for other peers?
Once again, the grants must be obtained through a nonprofit. So if you have a nonprofit agency or organization, yes. And there are nonprofits that do this. I know here locally in the Buffalo area, there are nonprofit peer-based groups that do apply for grants and get grants. But that's one of the main criteria I know for federal grants is that it must be through a state-based or nonprofit organization. I mentioned before earlier about the Behavioral Health Career Workforce Navigator. This just came out a couple months ago, or maybe actually only about a month ago. This is great because what it's done is it helps individuals who are seeking licensure in different states and tells you what the criteria are for the different types of behavioral health providers, whether it be a licensed clinical social worker, a credentialed addiction professional, a peer. So what it'll do is it'll tell you what the criteria are necessary to gain those specific certifications. You might have someone say who is in New York, for instance, it's going to move to New Jersey. Well, I need to know what it means to be or what it takes to be a licensed clinical social worker in New Jersey. Because what happens is states have different criteria for different certifications. So if you are able to, or if you want to know what another state requires, this behavioral health navigator, career workforce navigator, will be able to help you with that. And it's a great tool. I've gone into it, I've looked at it, and it's really pretty neat how they've done that. It took a lot of work to get it all in place, but it's fluid. It can be changed if necessary, but it is up to date as of right now. So anybody on the call or on the meeting right now that's interested in learning about this more, you would just Google SAMHSA Behavioral Health Career Workforce Navigator, and that information will come up. There's also additional information on finding support for issues with mental health, drugs, or alcohol under samhsa.gov/find-support. The national helpline is 1-800-662-HELP. And then also millions of Americans have mental and substance use disorders. And then findtreatment.gov is where people can go online and look for places to seek treatment in their communities. So that's another location for resources for folks that they can seek help. So SAMHSA has a lot of information, like I said, on seeking help in different kinds of ways. And in a second here, I'm going to try, hopefully, to take you to the SAMHSA website to show you real briefly what it looks like. We have training sites, more than 50 training and technical assistance sites. We have TTCs, which are technology transfer centers, which are more focused on training. And so SAMHSA does a lot of training just on all types of behavioral health issues and challenges and so forth. So, and we provide those all free of charge. Everything that I've shared about is free due to your taxpayer dollars, I like to say. So everything we do is for that purpose. And we are basically working for the citizens of the United States. So everything we do is for that purpose. we have the focus centers of excellence and the focus resource centers and technology transfer centers. They're all basically doing training in that area. Then we have regional level support. There are 10 regions in SAMHSA. As you see here, they're divided into states. Ours is a little bit different. We have New York, New Jersey, Puerto Rico, and the U.S. Virgin Islands. And that's how our region, Region 2, is set up. And I'll show you in a second here who the staff is. But basically, all over the country, you have the different regions and how they're broken up in terms of what they look like. And they also have tribal communities, that are part of the regions as well, tribal nations. So we provide leadership to advance behavioral health initiatives among federal, state, tribal, local, and stakeholders. We partner with federal agencies, states, tribes, territories, and local communities through relationships and building trust and community and respect and shared principles. And we provide consultation to guide development of behavioral policies, programs, and system transformation. So if you needed assistance with anything when it comes to these kind of things, we can help with that. We've done work with NAMI before. We've done work in terms of helping NJAMA a lot. We've had a great relationship with NJAMA. So we're able to do this. And like I said, we do it all at no cost. And it's basically what our charge is for all of us. So here's our staff right now in Region 2. We have Dennis Romero, who is our director, Commander Karina Aguilar, who's assistant director. She is in the Commander Corps, Mission Corps rather. And we have Roxana Hernandez, who is a regional behavioral health advisor, who just joined our staff a few weeks ago. And there's myself. Real quickly, our budget that is still in the process of being approved is over $7 billion, which is an increase of over $170 million from federal year 2024. And then also for the House, we're seeking a very similar amount, which is an overall increase of $95 million from federal year 2024. So really, it seems like a big budget, but all of this money is used for everything that we've talked about. And a lot of it, most of it is grants. So even though the title of the workshop is not about grant money, a good portion of it is for grants. I'd say more than anything. But we have a lot of other services that fall under our purview that the funding goes for. Real quickly, we just are doing a number of things. We are engaging faith leaders. We're working here in New York State to do programming for faith leaders. We have a program with the National Conference of Chief Justices. We're working with the Federal Reserve Bank of New York to do some programming for Puerto Rico and U.S. Virgin Islands to provide funding and to do some training. We have a diversification of funding streams through working with a grant maker and health initiatives and affiliates rather, and the community development financial institutions. We also have New York State Behavioral Health Tribal Consultations that we work with regularly. And also there's my work with Black youth and young men. I was a part of a presentation and a workshop this last spring with NAMI New Jersey, where I came and I presented on African American mental health. So here's the final slide and my contact information. Certainly you can contact me by email. I'm happy to respond. The numbers on the left are just the general SAMHSA numbers, so that's not my number, but the best way to reach me is by email. And I'm happy to try to help. If I don't know the answer, I can probably get you to the person who does. So, but yeah, so with that, I'm going to pause and I'm going to leave this slide up right now. So for a second, so you can jot down any information that you need to. But I guess we have a couple minutes and I'm going to ask if there's any final questions.
Thank you, Carl, for the great presentation. We do have a couple more questions, and I do want to encourage the audience to please put any additional questions that you have. We have a couple more minutes to answer questions. So one question is, so was SAMHSA involved in lobbying for 988? If so, why the exception?
I'm not sure what you mean by oh, you mean in terms of making the number 988? I wouldn't say a call, well, lobbying, I don't know if that's the right word, but we initiated that policy. The whole idea was to make it more accessible. The number before was 1-800-273-8255. Who can remember that number? As opposed to 980. We want to make sure that number is easy to access. What happened though at the beginning was, and I think it's gotten better, was that the system was overloaded. But now through the course of the last couple of years, there's been better response. There's been better attention paid to local providers who are able to provide the crisis response. So, but we were behind that policy to change that to that number.
Thank you. Let me just see here. So are only agencies that receive grant funding in these treatment and support directories? The state of New Jersey tends to only have funded providers in their directory. This leaves out agencies who haven't been able to obtain funding for whatever reason. I'm not sure you know that answer.
I don't know that answer. Because I'm not as familiar with the New Jersey directory that the person's speaking of. Yeah, that doesn't, I don't know. That doesn't sound like the way it should be. Of course, if there's a directory, I guess I'm not sure where the person's looking to get that information. I know it can be difficult to find out where all treatment providers are in a particular state. I know here in New York State we have a database, but every state's different. So I can't necessarily speak to New Jersey. That's one that I might want to do some investigating and find out more about.
Thank you. Yeah, I think also maybe they're referring to the SAMHSA directories, like
Oh,
only the grant funded programs and agencies found in these directories.
right. Yeah, that might be the case. Although we do have the findtreatment.gov, if that's what the person's speaking of, it should be everything. Because I know even here in New York State, we work with the New York State Office of Mental Health to identify all of the agencies here in West New York, or not West New York, New York State. So I would imagine with New Jersey it would be the same thing. I've been with the region for about a year, so that could be beyond my knowledge base, but that's best my understanding.
Thank you. And I will encourage this person to contact the NAMI New Jersey helpline. And if there's a specific resource you're looking for, we can help you navigate that. And it is 12:59, so I'm going to give you one more question and then we will close. Is SAMHSA looking at incubating supported work programs that work with disability?
I don't know. Certainly we've done work, in the area of access to supports for people with different abilities or disabilities, but more on a global level. So I don't know about incubating new programming or so forth. So I'm not sure about that. I'll be very honest.
Okay, no worries. All right, so that's a conclusion of our questions. And I just want to let everyone know that we did put the survey in the chat as well. Our survey, it is important to us. And this recording will be on our website shortly. So I want to take the opportunity to thank you, Carl, so much for joining us and sharing with us all of this valuable information. There was a wealth of information that you shared today. And thank you again for sharing this hour with us today. As a reminder, it would be appreciated if you could complete the survey at the end of the webinar so that we can incorporate your feedback for future webinars. And this concludes our webinar. Thank you all.
Thank you.
Thanks, Carl.